Bismillah ar-Rahman ar-Rahim. Acute myelogenous leukemia, AML. It represents 11% of the total cases of childhood leukemia. There are several chromosomal abnormalities associated with acute myelogenous leukemia, but there are no predisposing genetic or environmental factors. The most common classification of the subtypes of AML is the FAB system, which divides AML into 7 types from M1 to M7. The clinical presentations. It may include any or all of the findings associated with bone marrow failure in acute lymphoblastic leukemia, plus signs and symptoms infrequently occur in acute lymphoblastic leukemia, like subcutaneous nodules, infiltrations of gingiva, the IC, and secrete masses called chloroma. The diagnosis by bone marrow analysis and the treatment by chemotherapy or maybe bone marrow or stem cell transplantation. Chronic myelogenous leukemia, CML. It represents 2 to 3% of the total cases of childhood leukemia. About 90% of cases are characterized by Philadelphia chromosome. It may be associated with exposure to the ionizing radiation. The clinical presentation are nonspecific as fever, fatigue, weight loss, and anorexia. The spleen is often greatly enlarged, leading to pain in the left upper quadrant area of the abdomen. Typically, the chronic phase is terminated 3 to 4 years after the onset to the blast crisis phase, when there is dramatic increase of blood counts, hyperuricemia, and neurologic symptoms. The diagnosis by bone marrow analysis, when there is increasing myeloid cells, plus cytogenic studies representing Philadelphia chromosome. Treatment, it may include chemotherapy like hydroxyurea or interferon, but the optimum treatment is the allogenic bone marrow or stem cell transplantation with a cure rate of up to 80% of cases. شكرا جزيلا لإصغائكم.